EGM Network.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon, and welcome to Community Conversations. It's always a pleasure to be here because it allows me to talk to some of the wonderful people that bring our whole county to life in terms of making it better. Sometimes they're nonprofits, sometimes they're staff from Treasure Coast Community Health, sometimes they are for-profit organizations who nonetheless do wonderful, great things for not only their stockholders, but for the community at large. And so this week is no exception. I have a new gal, new to at least her organization, and new to radio conversations. So it may take her a while to relax and just have a conversation. Danielle, welcome on behalf of We Care.
Thank you. Thank you very much. Thank you for having me.
Well, I know that you have jumped right in as a registered nurse who's new to this particular type of thing. What did you do before you came to We Care?
Oh, I've lived many lives.
So I've heard.
Yes. But my nursing career started with at Lawnwood Regional as a trauma nurse there, and grew into just something amazing. It led me to meeting a friend who brought me to the VNA to do home health care, work for a non-for-profit organization to help those who are at need that need care at home.
Well, and that's very interesting because it's probably the exact opposite of what I envisioned when you sent in your resume, and I saw that you were a veteran who liked to jump out of airplanes.
Yes, I did. I served in the U.S. Navy for 9 years. I was a search and rescue swimmer. I jumped out of helicopters. We also did combat search and rescue on land. So we would go into the hot zone and rescue those in need. But my main job was search and rescue. And so we were an ambulance in the sky.
So I can see why when you joined Lawnwood, you were in the trauma side of things.
Yes.
Not delivering babies or other easier things.
No, I needed to keep that adrenaline going. And Lawnwood was just calling my name. It was definitely something that was a passion of mine.
And along the way, you met your husband and have had kids.
Yes.
So your life is settled a little bit more into conventional means.
Yes, we'll say that. My husband does shiver every time I see maybe a flight helicopter fly over, and maybe I want to get back into that. But having 2 young children, it's a little difficult to be able to do those types of things.
Well, you're making a difference already in the We Care environment. You want to tell us what you know about We Care, and I'll fill in the blanks from what Dr. Atuso told us as a volunteer physician.
Absolutely. So I learned about We Care through a mutual friend, and I started doing some research because I really wanted to know what everything was about. And I love helping people. And when I found out that it was a non-for-profit that does pro bono care for those in need, I knew it was something that I needed to be a part of.
You have a strong helper gene.
I do. And, my faith has led me this way. I definitely sat down and had some conversations with God to try to find out where I needed to be and where He was guiding me. And helping others that are in need is something that I've always done. And now to be a part of an organization that does this pro bono, it's amazing. It's been around since 1991. Helping the citizens of Indian River County.
Led initially by Dr. Dennis Saver, who was a strong champion to his colleagues, friends, and other physicians who, again, they usually go into it because they have a strong helper gene. The financial aspects of going through medical school and starting your own practice, kind of stretches that financial barrier a little bit. But Dr. Saver had a way of explaining to people it can be an hour, it can be 4 hours a month, it can be one day every couple of months. You're needed. You're needed by people who are not as well off in order to afford insurances, and or, as we have recently found out, sometimes they have insurance, but nobody takes the insurance. And so it's the same as not having any.
Correct.
And so those folks go through the qualifications with you, but if they're needed, if care is needed for them, they're considered as well.
Right. And I think with our physicians, what's amazing is you hear about those organizations and things, Doctors Without Borders, and where they go to other countries. And sometimes they're not always able to leave.
Right.
They have families and they have things as
exactly.
well, but they still want to help. And then where better to give back than in your own community?
And I think you make a really good point, because often we will hear, why are we doing so much overseas? Why are we helping people outside of this country? You're saying, and well said, folks are taking care of our own here as well. We just don't advertise it. Most of them are pretty humble. And so it just fits in with their persona to give back quietly.
It does.
So we do have 33 physicians on the roster right now, I understand.
As of right now, and we will continue to grow. They will start to hear the squeaky wheel coming from WeCare to give back to the community. Unfortunately, I think just with past years, medical field has, not the greatest outlook. And I don't think people hear it enough. And getting our name out there and letting people know that there are organizations out there to help. Mm-hmm. We are there. There's no underline. There's no, around the corner. We are here to help no matter what. We grow a relationship with our patients. We sit down and we have those conversations. Sometimes it takes a few phone calls to get them in because they are, they're
used to being rejected.
Yeah, they're scared. They're worried. They're worried they might get a bill. Mm-hmm. And even if they did, we figure out what happened and we go back and we make sure we get it fixed because they're not supposed to. We are here to help them. And it comes around full circle. We help those, they help their family. It keeps patients out of the hospital. We teach them on how to manage their care. They're able to provide for their family. It's an ever-going circle. And if we can close that gap, then we can make a real difference.
We talked a little bit briefly about the physician's role in this. Do you have other affiliates that also help in this program?
So not only we have other organizations. So it might not just be the doctors. Perkins Medical Supply is one of them. Perkins will help donate CPAP machines for patients in need for that. Some of our doctors, even if they come in for a cardiologist evaluation, that cardiologist doesn't always look at just the cardiac issues. Healthcare, as we know it, is turning into a whole person care. Mm-hmm. And it's not just about that one diagnosis. Mm-hmm. We're looking at them as a whole. We're looking to work with the VNA and look at their social workers to see what other things that we can help provide for these patients socially. What other needs, transportation needs.
It's huge. Huge in this county, despite the fact that we have a free go line. But
if they're in a wheelchair.
Right. It isn't outside everyone's door.
Correct. And it's getting to that place. Medications. We work with the financial assistance program. We work with TCCH. When we write our prescriptions, we encourage our patients to go to TCCH pharmacy to get them filled because they can get a discounted rate. There are things that can help every patient in every aspect. And
we have the free mail order so that they can get all their renewals shipped right to their house.
And they don't even need to go out the door. And that's a hard time. That's a hard thing, is getting places. And that's a barrier. So working with the community. If we receive a referral and there's something that we're not able to provide or there's a wait, we talk to the patient. We let them know, hey, right now, this is the situation. We work with Cleveland Clinic very closely with their financial assistance program. And if we need to, we help them get this process started to get enrolled to their financial assistance.
That's great.
So it doesn't just stop at our door. We look around to see what other avenues that we can do to help our patients. And that's even working. We have a patient that is leaving to go to another country.
Wow.
And so our physician said, you let us know what you need. We'll send over the information and have a discussion with that doctor if we need to.
That's amazing.
So it just doesn't stop at our door. And now having clinic in our office opens the opportunity to actually get that relationship with the patient.
Yeah, it's been a little funky, for lack of a better word, over the last 6 months because WeCare was stationed in an office owned by TCCH, and they want to have a little more independence, but not being led by a nurse. They acquired an office space, and it's like, how are you going to see patients in an office space?
Right. They were seeing patients over at the Up Center, which we are grateful for.
Okay,
and
for clinics.
The clinics.
Right.
And we're looking to expand our clinic times as well. But for WeCare, we need to be able to have the opportunity to see the patients and do our paperwork as well. So having an in-office clinic is amazing.
I'm glad it's working out. We're going to take a short break for a word from our sponsors, and when we come back, we'll talk a little bit more about some of the other services that they're offering right now. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock tariff-free coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats and chairs in the latest styles and colors from Tommy Bahama, Lexington, Hooker, Four Seasons, Braxton Color, and Capri. We're the outdoor furniture experts and have hundreds of styles of any patio furniture you need, including a gallery of American-made Telescope, Berlin Gardens, and Pollywood, all with no tariff ever. We specialize in fire pits, outdoor rugs, umbrellas, and replacement cushions. Right now, we're having a summer sale with lots of great markdowns and discounts on everything you need for your Florida home, including all pictures, lamps, and accessories half price. Sunshine Furniture, $12.95 US 1 in the Publix Plaza, Vero Beach. Don't forget to visit our outlet store directly across the street, filled with lots of name brand closeouts and sale items. Come in now for our summer sale and visit our website at sunshinefurniturecasual.com.
And welcome back to Community Conversations. If you're just joining, as I say every week, my name is Vicki Soulé, and I'm the CEO of Treasure Coast Community Health. Our board and our staff feel a great privilege to have us collaborate across a number of different organizations. As we often say, it takes a village, and we know that we are a small part of a multi-pronged attempt to improve the health of our community. We have been supported greatly by the Indian River Hospital Tax District every year for the last many, many years, and we are so appreciative because without that, our humble nonprofit would not be able to serve as many patients as we do. And so when smaller organizations than ourselves, because we have had the honor and privilege of growing into meeting needs, as we develop different infrastructure models, we recognize that smaller organizations might not have that. And so we do reach out and help them with those things. And it's through that collaboration that I'm so aware of what WeCare is doing and happy to have Danielle Wynn here today with us. So Danny, we talked a little bit about the physicians. We talked about the partnerships and collaboration that you all do as well. One of your main clinics, as you mentioned earlier, is cardiology.
Yes.
something that really shouldn't be put off if you're having some cardiac issues.
Exactly. And we have the pleasure of having Dr. Screeden, who holds a cardiac clinic once a month,
Okay.
taking on 1 to 2 new patients, as well as seeing his patients that are already established.
It's not a one and done with him,
No,
is it?
he follows up with all of his patients.
He's wonderful.
We are on they could call the office. They talk with me. I can triage what's going on. I call Dr. Screeden and I collaborate with him. He will personally call the patients and follow up to see what's going on, to see what our next steps are.
That's great.
It's amazing. He, like I said, he holds monthly clinics. Our next clinic will be August 5th. And where he sits down and looks at the patient as a whole.
So I have a question. You mentioned that he only takes 1 to 2 patients a month additionally. So is there a wait list? And can people self-refer?
So right now, I don't want to say that there is a wait list. Right now, the next opening would be in October, but things change. It all depends. We do triage our patients to see the need of the patient. But self-referral is not something that we recommend. We do recommend that you do follow up with your primary care physician, whomever that may be, to get a referral sent in.
I know where they could go if they don't have a primary care physician.
TCCH is one of our number 1 referral sources as of right now, as well as whole family. Yes, and we also do get referrals from the hospital as well. We do need a physician referral, though.
Okay.
And then our physicians are able to refer out. Dr. Screeden has referred many patients to ophthalmology, which we have a number of clinics that are around Indian River County that see patients, and they see patients right in their own clinic.
And that's wonderful. What a huge help to be able to go to one of the established eye care ophthalmology areas and have that as a resource. I know that I have heard about people getting cataracts removed who could not afford it relative to their income and not having insurance that would cover, the bulk of the cost. Those supplies, those cataract lenses actually are being paid for by the hospital tax district.
Yes.
But the physicians and their staff, that's all pro bono, free time.
Yes, that is all. They have, they volunteer their time to see those patients. And again, that is not one and done. Those patients then have follow-ups. They need eye drops. They need follow-up appointments.
Oftentimes they'll only do 1 cataract where 2 are needed, but they separate by a few weeks,
correct.
a month
or so. And then they'll go back and go get the other cataract done. And then the great thing is the referral is good for 1 year. So every year our patients do have to come back through. There is a process where you have to make sure that you're eligible. We do want to make sure that all of our patients are eligible and following the guidelines of the state of Florida. So we do follow up on that.
Now, you mentioned the state of Florida. There is an organization that is pretty unique that is not something Treasure Coast belongs to, but We Care does. The Florida Association of Free and Charitable Clinics.
Yes. So we are part of the Free and Charitable Clinics.
As is HANDS in St. Lucie County.
Correct. Yes.
And separate organizations.
Completely separate.
Same philosophy.
Same thing. I'm pretty sure that HANDS, though, as well does primary care where we don't.
That's true.
We do focus on specialty care. We do not have primary care at the moment. It doesn't mean that it's not ever going to happen. We're always looking for any type of physician who's willing to volunteer their time to help out help out the community.
What about nurse practitioners and physician assistants?
Are all welcome.
Okay.
We are not restricted. We even have a med student who is willing to volunteer her time to come in and help with anything. She even said she'll file paperwork.
Aww.
So people volunteering their time to help out those in need. It's something that our community needs. It brings us closer together and it shows community.
Mm-hmm. Absolutely. So what do you think will be the next, I want to call it the leaderboard. which clinics do you see coming back online after a bit of a sabbatical? You said you were planning to make office visits.
Yes.
So not so much the physician, but the type of specialty.
So right now I am definitely looking at GI, neurology, and I'm also looking into physical therapy.
Oh.
So those are my three that I've been seeing some referrals come in on.
Okay.
So I will be making some phone calls. I actually made some phone calls this morning.
What about the non-traditional things like acupuncture?
So we do have acupuncture.
Oh.
We do have acupuncture that is part of our services, and that can treat
Interesting.
things from hair loss, anxiety. They have a number of things that they can treat with acupuncture. And again, we're treating the patient as a whole. We had a patient that came in to see the cardiologist and then went to get, further resources. And once you're part of We Care, you can continue to get resources with other referrals.
Mhm.
So that doctor just sets up a referral and then we continue on the process.
That is so amazing because having come from a bigger city for many of my clinical years, that just wasn't possible. And so I think that's what makes Vero Beach and Indian River County the special place it is.
We're a small, big town.
Yeah, there you go. A little town grown up.
Yes, we are.
So what kinds of things would you like to share with us in the last 2 minutes? Anything special? Not to put you on the spot or anything.
No, not at
but-
all. In regards to,
Well, how do you see it playing out over the next year?
within the next year, I have lots of goals and lots of visions for myself. I'm definitely inside my own head with that. I want to open up a Saturday clinic because my idea is that a lot of our patients, or a lot of the people in need, are those who have to choose between getting health care and going to work to put food on the table. So why not offer up the opportunity to allow them to come on a Saturday where they don't have to make that decision?
And I'm assuming that you would love to have some nursing volunteers to help you
Yes.
so you wouldn't have to work every Saturday
Yes.
and miss your little ones.
Well, and the good thing is that as a nurse community, there are a lot of nurses out there who are willing to help. So we just got to get our name out there and let them know that We Care is still here and still able to do things. And
And we have a website and a
Yes.
Facebook page.
correct.
And what's the phone number if someone wanted to get a hold of you to ask questions or to volunteer?
Oh,
Oh, she
so
says.
the phone number.
Oh, well, a stump the star.
Yes.
Okay. I will confess you have been with us a very short time. I would not expect you to have that. But it is up on the screen, wecareofirc.org. You can navigate your way over to the 787 building on 37th Street or stop in if you are either at Treasure Coast or Whole Family, because we're all within about a half block of each other.
Yes.
Which works out really nice relative to transportation. So I'm so glad that you came today. And
Thank you.
I know you're going to do a super amazing job.
Thank you so much. And thank you for having me.
You're very welcome. So next week, we're going to be having somebody, again, not a traditional guest, but on August 5th, we will be having a music therapist. And she deals with, again, a very unique population. And so it will be a very interesting conversation if you can join us then. Every week we have someone that either a friend of a friend recommends or volunteers to have just a little bit of time and attention to share their good news as well. So every Saturday, 4:30, and I hope you have a wonderful evening. Take care now.